in internal medicine. But the first thing is that internal medicine is split in two units. Okay, unit one up to unit five. Unit one, cardiology, going like that. I was in unit three, and unit three is pulmonology and infectious diseases. So, in a specific unit in which you are, those are the conditions that you'll be meeting most of the times. For example, I was in pulmonology and infectious disease, unit 3. Most of the conditions that we used to deal with every day were conditions about TB, chronic obstructive pulmonary diseases, things like asthma, okay, things like pneumonias. Those are the diseases that we used to talk to deal with most of the times. Diseases that are infectious in nature, those that affect the pulmonary system. But then 6 weeks after, we expected that you know all the conditions, because in the group in which you are going to be put, in the unit you are going to be put, the doctors that you are going to have are going to be specialists in those units. So as you're having round, when you click, you'll be expected to click from your unit most of the times, okay, and present to them, because you want to present asthma to a specialist that has done it. But of course, they also allow if you click a case from any condition. But most of the times, because for major rounds, they simply visit their own patients. Doct- Doctors for the heart to be visiting cardiology patients, and same like that, doctors that have got that deal with pulmonology will be visiting conditions patients that have got those conditions. So on major ward rounds, these are the ones that are going to visit, and on call, mostly these are the patients that they'll be seeing. So you'll be expected to collect more of the cases from your unit. So you discover that you are going to know a lot about a case from your unit. But 6 weeks later, when you'll be having your OSCE, you might maybe have a case from if you're in internal medicine. For example, I was in pulmonology, but when I was having my OSCE, the case that we I had was taking history of a patient with thyroid hyperthyroidism, Graves disease, and that is an endocrine disorder. It's not from our unit. So that means that you should be able to have a good clicking skill such that you can click a case from any condition. Now, besides you being able to click, clicking is basically asking questions and writing down. To click is to write down what you are asking. You also need to make sure that you have got data. But as I've said, most of the times you'll be in your units. So meaning that some of you will be having a lot of data of heart failure because you've been in cardiology, a lot of heart failure, a lot of data for rheumatic heart disease, a lot of data for infective endocarditis. But you will barely know anything to do with pulmonology. So if they tell you CAB 56, you'll be saying, what is that? Right? Because you have not rotated in this one, and that's a tricky thing. So you have to study extensively, because most of the data you are going to have will be the data from your unit. Okay, that is why for you studying has to be extensive. But then it is 6 weeks, and most of the times you'll be clicking, writing history, submitting. It will be so tiring for you to start now reading conditions from other units of the other 5 units. That is why you have to be so strategic. If learning is gonna help you, have join learning. If you know maybe learning doesn't help you, studying is gonna help you. If you are gonna have that time, do it, because mostly the first rotation is a bit of hemorrhagic, because that's when you are learning the art of clerking, you are learning the doctors, you are learning the behavior of the ward. So the results might not be too good. I started with internal medicine, and I feel starting with internal medicine is very good, because internal medicine is going to give you like the general outline of how you click. So after internal medicine, you are going to go to obstetrics and gynecology. In obs and gyn, it is basically the same click sheet that you are using for internal medicine, but now you are specifically clicking a woman, which is specific. Either she's having an obstetric condition or a gynecological condition. Obstetric meaning maybe related to pregnancy, and gynecology is just related to the reproductive system. After that, you go to pediatrics. You just modify the same click sheet for internal medicine. Now you'll be asking children. That is the goodness of starting with internal medicine. Then you go in surgery, where In surgery, you even barely be clicking because there most of the times is just attending rounds, discussing, being wired. So the people that you start with the surgery and the obs and gyne, it is going to be trick for them if they come to internal medicine because they are used to that kind of life, not for clicking. You don't click very much, and then you come to internal medicine where they love clicking. Okay, so you guys are actually going to be the best, expect to be the best because you are really starting with something that is so general. Actually, internal medicine, we call it medicine. This is medicine, and then the other components they are given names: obstetrics, surgery, okay, peds. This is medicine. All right, so having understood that, we can now look at an outline. How do you click? So in clicking, so when you will be having a word round, you want to find out what is wrong with a patient, right? A patient comes to you for the first time, then you want to find out what is wrong with this patient. What are you going to do? You are going to start asking them questions so that they tell you information about that. So in order for you to make a proper medical diagnosis, there are three things that you do. There are three things that you have to do. The first thing that you do is take a good history. Okay, and most of the times we call it a relevant history. In internal medicine, we emphasize that you ask questions on everything. But as you go to these others like pediatrics, uh, pediatrics is also a bit like internal medicine, just like yeah, more like internal medicine, just that it's a child. The only thing is that some things are a bit specific to a child. But if you go in surgery, you're expected just to ask relevant things on that specific thing. Obstetric and gynecology also just ask specific things. But in internal medicine, you're expected to ask every question, and then now you make sense out of it. Okay, so when you take your history, you should be able to get about 70% to 75% of the diagnosis. If you can't get it now, you do the physical exam. The physical exam. And it should be an extensive exam, a full body exam. You examine the entire human being. Let's say, for example, someone comes with a respiratory condition. You will not only be examining the respiratory system, you are going to examine the entire human being. And then you are going to do the investigations. So this is how they actually bring things. So investigations and the management. Now for management, you don't really manage yourselves because management is for seventh year. But here we talk about what we call the principles of management. Principles of management. Okay. For example, if a patient comes with let's say heart failure, you are going to take a history. Because how do you take a proper history? Because you know the signs and symptoms of heart failure. If you don't know the signs and symptoms, you will not be able to ask right questions. You actually run out of the questions to ask the patient. Because the way some exams come is that they'll just ask you, write 5 questions that you are going to ask your patient. Okay, they tell you a patient is complaining of chest, easy fatigability, and then when they sleep, they are waking up at night to catch a breath, and then they start asking you, write 5 questions that you are going to ask the patient. So for you to be able to come up with those 5 questions you are going to ask the patient, the first thing is that you know, okay, if someone is having easy fatigability, they wake up at night to catch a breath, this can either be a respiratory condition or it can be a heart condition. So that is going to help you now to start asking questions to narrow down to either a heart condition or to a respiratory condition. All right. So that is what you do in the history, meaning that you need to have the data of pathology, you need to have the data of neuroscience, and you need to have the data of microbiology, and of course, pathology. Okay. And then you do a physical exam. The physical exam, you are going to examine the entire body. First, you are going to do a physical exam. Once you do a physical exam from the head to the toes, and then now you start doing system by system. You are going to examine the GIT, the same GI exam that you learned in clinical skills. You are going to examine the respiratory, the same respiratory exam that you did in clinical skills. You examine the CVS, you examine the GUT, you examine the nervous system. That is why for internal medicine, when you are just mid-term, okay, on the middle of the academic year. Not the academic year, but the middle of internal medicine, because internal medicine is 6 weeks. So the middle, that is like 3 weeks from now, or maybe they can add a week for you, 4 weeks from now, you are going to have what we call the short case and long case. So in the short case, they are going to give you a short condition. For example, in pulmonology, they like giving you. So if they take you, let's say, to the wards E21 and E12, mostly you might find a patient that has got a pleural effusion. Okay, they'll just ask you, come and show us how do you perform a physical exam. So we'll be showing, okay, a physical exam, let's say for a respiratory condition. So a respiratory exam, you'll be showing, okay, you start, you greet the patient, and you do all those things. I'll talk about that physical exam, but that's what you do. That's for the short case that you'll be writing 4 weeks, 3 to 4 weeks from now. Okay, they'll basically ask you, they can even ask you to just take a history, but most of the times short case is how to do a physical exam. Any exam, it can be a nervous exam, maybe the GI exam, or maybe a respiratory exam, any one of those. Okay, and then you also have the long case. Actually, on the same day, you are going to have the long case and the short case. So the short case just takes about 10 to 15 minutes. Long case, they are going to give you 45 minutes, where you are going to collect the patient, collect them fully. You are going to take a full history of all the systems, and then you are going to write the summary, and then you are going to take a physical exam. You are going to examine all the systems. That's 45 minutes. So in 45 minutes, you are going to do the history, you are going to also do the physical exam for all the systems. Meaning that you need to be clicking more often if you are going to know how to click and what relevant questions you're supposed to ask a patient. Because if you don't click, you will not know on that day, because you are not going to have a click sheet. At least when you be going on the word, you can check your phone. Okay, this is a question I can ask when I'm taking history. But when you are on the long case, short case, you don't have that. You can actually be very, very frustrated. Okay, and that means you need to have extensive data on all the topics that are relevant on the word. And in each unit, there are important topics that are relevant. For example, in cardiology, heart failure, rheumatic heart disease, infective endocarditis. In pulmonology, TB, asthma, chronic obstructive pulmonary disease like emphysema and chronic bronchitis. If you go to the kidneys, you need to know nephrotic syndrome, nephritic syndrome. Okay, that is high. And then when you go to the endocrine, you need to know Graves' disease, you need to know diabetes. When you go to the nervous system, you need to know epilepsy, stroke. So you have to know the high yield, such that if they ask you anything, any patient that they give you to click, at least you know how the condition presents, and so you know what questions to ask and how to examine the system. So please, data very important, but also how to know the steps to follow, very important. All right, do I have any questions before we now step into how to take a history? Are we okay? So what I've just described now is the short case that will be 3 to 4 weeks from now. So meaning that data should start accumulating already. Okay? In case you want to forget pathology, you don't forget pathology here. In case you want to start forgetting neuro, it's not here. In case you want to start forgetting microbiology, no, 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 no. Okay? And then 6 weeks later, mostly in week 7, week 8, week 7 or week 8, you are now going to have the OSCE. You are going to have the OSCE. Okay, so the OSCE is now going to again have stations. Some of the stations, you will just be maybe going to explain urinalysis. Other stations will be going to identify some things. Other stations will be going to actually do the physical exam while the doctor is looking at you. And then other station you're going to be going to take a history. Okay, there will be like 10 stations. So you've seen how the 6 weeks is. Already the 6 weeks you have got on the middle, long case and short case. At the end, you are going to have the OSCE, and then you are going to have the written paper. The written paper is literally a full exam, basically all the topics that you have in internal medicine. So you have to accumulate that data before 6 weeks for all those topics, so that you can write and clear that paper. So that one, it doesn't matter if you know how to click. If you don't have data, you'll not answer. But if you've been on the ward for long, because most of the questions that they bring are questions that are relevant on the hospital setting, so you'll be able to answer them well, because the conditions that are common that you'll be clicking every day, those are the questions that they bring. Okay, that is a goodness with the word. Otherwise, it's a very friendly and interesting year. So now, starting with the history is basically the same outline that you know. When you are given a patient, please, the first thing that you want to do is, before you start asking a patient anything, make sure that you do the introductions. Okay, introduce yourself, very important. Introduce yourself, your capacity was sent you. My name is Musenge Mwanza. I'm a fifth year medical student. I've been sent by my doctor to just come and talk to you so that we find much about you, so we can help in giving a proper treatment to you. Okay, so that is introduction. All right. There's a phone ringing here. Okay, sorry for that. So, as I'm saying, you are going to take a. So the first thing, please introduce yourself. When you have introduced yourself, at least, please don't be doing the same thing you used to be. Of course, it's good what you used to do in skills. My name is that's a fourth year medical student. I've been sent by my AA. You don't have AAs here. I've been sent by my doctor. Please, you are talking to the patient. It's not like you are trying to remember what you have swatted. Okay, my name is Musenge Mwanza. I'm a fourth year medical student. I've been asked by my doctor to come and ask you some questions that will help us in finding out what's wrong with you so that we can treat you well. Is that okay? Talk to the patient. Don't bring data that you've swatted, and then if you make a mistake, my name is Musenge. I am a. Oh, I've forgotten this first word to say is this one. No, 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 no. Talk to the patient, because the importance of introduction is you are trying to establish a rapport, a relationship. Trust me, some patients are going to be hard. They don't want to talk to you because you don't have a relationship with them. While for some students, some patients will really love them a lot. Immediately they see them, oh, quickly you go and you start asking them questions, and they are ready to give you anything, because the information actually that to be given here are sensitive. Some of the people are actually married, and even their spouses don't know. Some of them, their spouses don't even know about their HIV status, but that information they have to tell you. So they have to trust you first. That is why you are introducing yourself and developing a relationship. And then before you can go any further, when you've introduced yourself, you want to make sure that you find out about the patient. Okay, but before then, get consent. Consent, very important. And here the concept we get is not a written. It's not like we are doing surgery. It is just verbal. Is that okay? My name is this. I'm being sent. Is that, can I ask you some questions? Is that okay? If they agree, you go on. Once they've agreed, let them also tell you about them. Okay? So they are going to also introduce themselves. So ask them their name. So we don't call them patients, we call them clients. So I'm now going to find out the client's name. Okay. You can also find, but about the phone number, you really don't ask about that. What's your phone number? No. Okay, you find out about their name. Okay, that's important. Now, for you, this thing that I've started here, that is going to be the demographics. So let me put that down here as a demographics. So demographics is basically finding out the information that is relevant about the patient. So what you want to find out first is the name of the patient, of course their sex or gender, and normally we don't ask them. You are even seeing this is a male word, you ask them, are you male or female? No, you don't do that. Okay, you just write down this is a male, because it's not like you are narrating, you are telling the doctor. Even when you are doing the history in the exam, the doctor knows that what is the person in front of you is actually a male. Or in case you just want to emphasize that someone knows that you are talking about, you know that you're supposed to ask about sex, you just ask, can I address you as sir? Okay, but please, you don't. That's not even necessary. Even the doctors will not even penalize you much for that. Okay, so ask about the sex. These are demographics. Remember, ask about where the patient stays. Okay, where does the patient stay? So that is the residence of the patient. That's also important. And also the religion of the patient. Where does the patient pray? If it's a Christian, please just ask the church, because in Christians also you have got the JWs, they don't receive blood. So if you just write Christian, that might not be specific. Let's say this is a patient that has got anemia, we're clicking a case of anemia, and they need to receive a blood transfusion. So if you just say Christian, it will not be so relevant, because you need to find out. Some Christians can receive blood, and in case of anemia, it's very important. Okay, so you got to find out about the religion, and then also who is informing you, who is the informant. Is it the patient themselves who are telling you information? Because when you are clerking, remember clerking is you are writing down. So you're also supposed to state who was answering the questions that you were asking. That's the informant. And then you want to take note of the date of admission. That's important. The date of admission. And then because you are going to be writing, let's say this patient was admitted on the 1st of January 2026. And then you are clicking today, the 14th. So also write down the date of clicking. Okay. That is going to tell you how long the patient has been in the hospital, and probably how chronic the condition has been, or how long the condition has been, how long they've stayed in the hospital. So these are some of the important details that you need to find out in the demographics. So demographics is really about the data about the patient, the data about the patient. Okay, once you've gotten the demographics, the next thing, now you've gotten the information about the patient. Okay, so what? Because that is not going to give you anything about what is wrong with the patient. You now want to find out what is wrong with the patient. So now that's the chief complaint. What has brought you here? Okay, so we are going to ask about the chief complaint. What has brought the patient to the hospital? So just ask them that. What has brought you here? Okay, what has brought you here? What brought you? That is important. They are going to tell you no. Some patients, they are going to, please don't interrupt. Ask to be able to find out much about the patient. Ask open-ended questions. Let the patient speak out their mind. And remember, you are going to be writing. So you got to be sharp if you want to be listening and writing. Or the best is listen to the narration of the patient and then write later if you are not going to forget, because it's again not, it's inconveniencing. You're asking the patient the same question over and over. That they get tired because they're going to be collected by many students, and then they're getting tired, so they might start refusing to for you to click them. Okay, so have time. Not the patient is speaking, you write. Okay, it shows some bit of disorderliness. They say anything, you write. Oh, okay, okay. It will take a lot of time, but if you can talk to the patient, you are listening to them, like you are calm, you are talking to the patient, you are listening to the patient, and then you jot down at the end. Or even best if you are the two of you, but we advise that you click alone. Okay, you, if you are two of you, you be clicking, talking to the patient, the other one is writing. That will not be interrupting, because you ask a question, you write, you ask, you write. The patient will be uninterested sometime. Okay, so what brought you here? You find out what brought the patient to the hospital. When they tell you, let's say they tell you, no, this has been paining, this has been happening, my heart has been doing this, and then ask, for how long has that been happening? For how long? Now, if they tell you how long, please, you need to be able to record this. Let's say, for example, the patient has told you that, okay, I'm going to state this one later. But after you ask for how long, you also ask anything else. Okay, because the first thing that they will tell you is what has actually brought them now. But there might be other things. So ask them anything else that is wrong. Okay, They might tell you, actually, I also had this 40 years ago. No, I've also been. You can actually come to discover, for example, if someone has got rheumatic heart disease, let's say someone comes with heart failure, right? They are in their 20s, a female person who is in their 20s, early 20s, or maybe 25. They come, they have got heart failure. They tell you, no, I've been having difficulties in breathing. My legs are, I've noticed that they swell. Even I'm having, my belly is swelling. You know, these things, I'm having difficulties in that. So that is showing you signs of heart failure. But then in a young person, you'll be thinking, what can cause heart failure in a young person? Because it's a chronic condition. Mostly, it is because the patient has actually been for a long period of time, maybe with diabetes, with maybe some atherosclerotic problems, a chronic condition. So most of these conditions happen in the older. But why is it is that it's in the young? So discover, if you ask them, how long have you had this problem? They'll tell you maybe, okay, it started 2 years ago. And then you tell them anything else. They might remember, actually, when I used to be young, I used to get sick of this a lot, but they might not even remember when they used to be young. But this should tell you, it means that you need to have now data. This is where data comes in a young person coming with heart failure. They should be, they might have had the rheumatic fever when they were a child. Did you used to have maybe a sore throat when you are a child? Or maybe if parents are there, umwana alerwala po ichifuba sana kubwaiche, or maybe just a sore throat fever when they were children, because that's caused by streptococcus. And that guy, what it does is that once the sore throat is not treated, it normally affects children between 5 and 15 years. Okay, if it is not fully treated, what is going to happen is that later on it can develop into what we call rheumatic fever. And some few years later, it can actually develop, like if it passes 2 to 6 weeks, if it is a sore throat, it can go into a rheumatic fever. And then a bit 10 years later from the rheumatic fever, it can come now into rheumatic heart disease. It starts affecting the valves, and that can lead to heart failure. So that is we call that as the natural history of rheumatic heart disease. And the one complication is heart failure in young children. Okay, or in the young, not really young children, but in the young. For example, a girl who is 20, a guy that is in their 20s. Okay, so this is where now data has to come in. So it's very important. Let's say now you had asked them, they told you that they've been having difficulties in breathing for 2 weeks. Okay, difficulties in breathing for 2 weeks. So we're going to write, I'm going to put here, e.g., the way we are going to write the chief complaint is difficulties in breathing. Please, the chief complaint, write in patient's language. Don't use medical terms. Okay, so we can say difficulty breathing. You are going to say, if it has been for 2 weeks, remember in a year there are 52 weeks, so you are going to say 2 out of 52. Immediately you write over 52, it means that the number on top is in weeks. Let's say they tell you that they actually also experienced, uh, and you are writing these things in ascending order. So you write the one with the longest, that started, the one that started earlier, and then the one that followed, and such. Okay, you write in that order. Let's say they also tell you that they also started experiencing, they also noticed the legs swelling. That's edema. But don't, anyway, you can write edema. Edema is not too medical, but just write leg swelling, and be specific which leg. Maybe left, or maybe both. Okay, so in that case, we're going to say bilateral leg swelling. Let's say you are clicking this case today, which is the 14th, and this bilateral leg swelling started, they say it started on the 12th. So that was 2 days ago. So I'm going to say it's 2 days. So 2 days out of 7. So you say 2 out of 7 because you are not dealing with days. So days you write out of 7, weeks you write uh, out of weeks, which is 52. You can also write in months. Let's say they tell you that they actually have been having abdominal swelling. That can be ascites, because in heart failure there's ascites for 2 months. So I'm going to say 2 out of 12. If you say out of 12, that means that we're not talking about months. Is that okay? Do we understand how to write the chief complaint? Do we understand? Is this okay? Okay, very good. Please write them in order, the one which is started first to the last one. Okay? You write first to last. So what is started first? It was the difficulty in breathing. Okay, what followed? The swelling. Okay, what came next? This thing. You write like that. After you do now the chief complaint, the next thing now will be the history of presenting illness, HPI. Now in the HPI, what you are basically breaking down are the same things that you've given you in the chief complaint. So in other words, you need to identify what system are the chief complaints coming from. Okay, so what you do is ask more about chief complaint. This is what happens. For example, the difficulties in breathing. When does the difficulties in breathing come? Is Are you experiencing the difficulties in breathing every time, like throughout the day, or it is worse at night, or worse in the morning? Is it worse in the afternoon? Okay. Is it worse when you are sleeping, or when you are awake, when you are even seated? Okay. And then what happens with that difficulties in breathing? Do you experience the difficulties in breathing when you are doing heavy chores, or even when you are doing nothing? That is actually going to tell you, even you can actually even stage the heart failure using the New York classification. Okay, because for heart failure you can classify it depending with the symptoms that appear at rest, or when they appear when you are doing little exercise, or maybe unless you do vigorous exercise. So ask more about the chief complaint, and if that chief complaint is pain, if it is pain, you are going to ask using the Socrates. Okay, you are going to ask, where is the pain, the site, where is the pain? The patient is going to point you, it's here. So if the patient points, you need now to put it in medical terms. Again, you write the HPI in the language of the patient. Don't use medical terms. Don't use dyspnea in the HPI. Just say difficulties in breathing. Don't use PND, or what other medical condition, medical terms. Use the words that the patient told you, and then you write HPI as a story. Okay, write it as a story. Write as a story. So you are going to say, okay, the patient was well. You can start that like that. E.g., patient was well until dash 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 dash. So the patient was well until, since here we've said that this patient has been having difficulties in breathing for 2 weeks. Let's say they experienced the difficulties in breathing for 2 weeks, but then this difficulty in breathing was actually 2 months ago. It's now gone. So you are going to say the patient, but in the chief complaint, remember you are writing what is there now. Okay, because you can have other problems that a patient had. Those ones will come in the HPI. So the patient was well until 2 months ago, when he started experiencing difficulties in breathing that lasted for 2 weeks. Maybe 3 days later, the patient went and visited Kanyama Clinic, of which he was given, let's say, he was given a loop diuretic, or maybe he was given an identified medicine, which barely helped. And then 2 weeks from then, the patient now went to Kabwata Clinic for further assistance, of which he was given an hypertensive, which could barely help. And then 2 weeks ago, the patient came to UTH, of which he has been given this drug, that drug, and has been improving. That is just a description of the difficulties in breathing. You also be talking about the heart failure. So, I mean, the bilateral leg swelling. 2 days ago, the patient also noticed that the legs were swelling. of which nothing has been done, or maybe of which something has been done, what has been done, anything. So you're describing it as a story. Let it flow the way events are going. But of course, you need to, because you are now the one who is clicking, the patient is going to tell you everything. They are going to narrate a story, even how they go to the toilet. No, actually, I now went into the toilet in the morning. In the afternoon, I also went to the toilet, but I wasn't helped. Okay, in the night, I went 15 times to the toilet. There's some toilet data that is important that you can put down, but make sure that you know which data is relevant to the condition that you are clicking. Okay, if I'm asking about a heart condition and then someone is talking about the toilet, I can discard some of that data unless I feel that data is actually important to my condition. That's the one I'm going to put in the HPI. All right. So for the secret, you are going to talk about the site of the pain, the onset. How did the pain start? Did it start gradually, or it just started push, and then it was being felt? And then what is the character of the pain? Is the pain like piercing? Is it throbbing? How is the pain? How do you feel it? And then is the pain going anywhere? Is it radiating? Okay, maybe it starts in the lower right quadrant and then it's going towards the umbilicus. Okay, that pain is typical of appendicitis. So I might be thinking, okay, this might be appendicitis. Already, if someone tells him that the pain is in the right lower quadrant and going towards the umbilicus, I'm already thinking about appendicitis. And so even I'm going to think of more questions to ask in the HPI to do with appendicitis. If I know now the clinical features of appendicitis, okay, the appendix can actually get to perforate. So I'll ask more about the appendicitis, starting from the risk factors. I ask about the risk factors for appendicitis. If this patient, let's say, has been drinking alcohol, did they have surgery? Okay, those are risk factors. And then after I come from the risk factors, what are other associated clinical features of acute appendicitis? Remember the mantrails? You guys learned clinical skills. There's the mantrails, which are the features of appendicitis. So start asking about that. Okay. The migratory pain, you are going to be asking about it. The of course the pain also in the right quadrant, that is going to be felt when you palpate there. And then even when you palpate the other side, they can also be still referred pain to the other side being felt. And other questions that you can talk about, things you can ask about nausea, vomiting. Okay. So you need to know the clinical features, the risk factors for these conditions if you want to click well. So that is what you do. In the HPI also, you need to identify the relevant system that your chief complaint is falling in. So review the system of the chief complaint. Okay. Review system of chief complaint. So in this case, if someone is having difficulties in breathing, there are two possible EG. So I'm going to say EG, difficulty breathing. So for difficulty breathing, mostly these are two systems. It's either it is the respiratory system or it is the CVS. So I'm going to ask all the questions about the respiratory system in the review of system. And I'm going to ask all the questions about the CVS in the review of system. Sorry, in the HPI. Because these are part of the chief complaint, and that chief complaint has got the features of respiratory and CVS origin. So you put them in the HPI, not the review of system. Another thing at the end that you are going to ask in the HPI is the B symptoms. Okay, B symptoms, we call them constitutional symptoms. These are things that someone that is sick experiences, but then they don't point to one to a specific problem. For example, fatigue, okay, malaise, weight loss. Those are non-specific. Okay, they are non-specific, and also loss of appetite. Though mostly loss of appetite, we are going to be putting it in the GIT. but sometimes it's actually included here. So you ask about the B symptoms as the last thing. So the last thing in the HPI is the B symptoms, the constitutional symptoms. Any question? Are we okay? Are we okay? So when you ask about the B symptoms, now you can review the systems. Okay, review of the systems. The systems that you reviewed in the HPI, you are not going to write them in the review of systems. So for those systems, let's say the CVS and respiratory system, you reviewed them in the HPI, you just say CVS and the respiratory system as reviewed in the HPI. Okay, as in the HPI, CVS and respiratory as in the HPI, and then you continue now. You are going to be writing mostly since this is clicking. You just be putting down. So CVS, you ask the questions that are relevant. So for the CVS, some questions that to ask you, things features of the CVS problems includes chest pains. Okay, because if someone has got a myocardial infarction, they're going to have chest pains. And then besides this, there's also, uh, of course, the orthopnea can also be here. Orthopnea, when fluid is accumulating in the lungs, that can actually make up someone to be failing to sleep flat. So orthopnea, you can ask here. And that is why mostly the CVS and the respiratory is asked together because the features are more similar. Okay, you ask about orthopnea, also ask about swelling. Like if someone has got edema and ascites. So that is it in here in the CVS. Okay. So these are some of the things that you're going to be asking in the CVS. And then when you now go to the respiratory system, here again you start asking about dyspnea, difficulties in breathing. In the review of systems, you can use the language, medical language. Others say don't use medical language, but you can use medical language in the review of systems. But for the chief complaint and the HPI, make sure that you are using the language of the patient. So you can talk about dyspnea, you can talk about PND here also. You can also talk about orthopnea. Okay. In the respiratory system, you talk about cough. And if you ask about cough, you are going to characterize the cough. Is it a dry cough or is it a wet cough? Okay. Wet cough just means it's productive. So you need to find out much about the cough. Is it productive? That means is it wet? Productive means it is a wet cough. And then much about the cough again, productive or not. Again, ask about the amount. If it is productive, what is the amount of sputum that the patient is releasing? The amount of sputum. If you find out about the amount of sputum, find out about the color of the sputum. Color of sputum. You find out about the color, find out about the smell or the odor of the sputum. Okay? Because these features will actually point to some specific conditions. Okay? Amount, color, the smell points to specific conditions. So you can ask about cough. And then also in the respiratory, ask about hemoptysis, coughing blood. Hemoptysis. Okay? Like that. You are going to also review the GIT. In the GIT, starting from the upper part going down. Okay? In the GIT, they can also have chest pains. Let's say if they have got gastroesophageal reflux disease. But this one normally is not really pain, but burning, be feeling the burning in the chest. So you just have to have that data. Normally for chest pain, we ask in the CVS. But know that in the GERD you can have that burning sensation in the chest because of gastroesophageal reflux disease. And then you'll be asking about abdominal pain. Okay, abdominal pain. Is there distension of the abdomen? Let's say if someone has got hepatomegaly, okay, splenomegaly. So is there distension? Oh, sorry, distension of the abdomen. And then it is here that you ask about jaundice. Remember in your pathology, which it was a very high yield topic, if there's liver disease, you can have pathology. And in case you want to be a bit extra, it's not something that is required. But if someone has got, let's say, jaundice, sometimes people with jaundice means that it can be a liver disease, and the liver disease can actually lead to hepatic encephalopathy, meaning that they can also have CNS symptoms already. Okay, so already when you are collecting a patient, because you can see how topics relate, those are going to help you to extensively break things in the HPI. Okay, you also ask about if there is any diarrhea, if there is nausea, vomiting, all that is GI. Okay, these are the things that you're going to be asking about. In the CVS, okay, I already talked about the swelling, okay, the peripheral, the edema in the legs and such. You also ask about the GUT, that is the urinary system. Now, this is just about the urine, okay, frequency. How often does the patient urinate? What is the amount of the urine? Okay, are they urinating too much or too little? That's the amount. Are they urinating blood? That is going to be also stated here. Hematuria. Are they passing any? Is there any discharge from the organs there? Okay, any discharge? So these are important questions you are going to be able to ask. Very, very important. The discharge, the color of the urine, also very, very important. Please, for females, very vital. Every female ask about the last time they had their menstruation. Okay, are they menstruating? Because they can be finding blood in urine, but they are menstruating. So that is not. That might just mean menstrual blood. For the GIT, another thing that I didn't mention here is hematemesis, vomiting blood. Hematemesis, even passing blood stool. Okay, passing blood stool. So the stool can actually have can appear red. That means that the blood is actually fresh. Or maybe there is actually an ulcer in the GIT that is more down. It can be maybe colorectal cancer. So the stool is going to appear red. But if the stool is appearing dark, it means that that is a upper GI bleeding. Upper GI bleeding, we just mean any bleeding above the ligament of Treys. The ligament of Treys is the ligament that holds the duodenum. Okay, the duodenum up. So anything above the ligament of Treys is upper GI bleeding, and mostly is going to the stool is going to appear dark, and then anything below the is going to appear red. Okay, like you are going to see red blood. So there is hematochezia. Okay, hematochezia. That is the blood which is so that is black stool. All right, tarry stool, hematochezia. Okay, so these are important, and then you also have the musculoskeletal. For the musculoskeletal, what you just want to ask here is the joint. Does the patient have any joint pain, any joint rash? Okay, these are the ones that you want to ask most of the times here. So these are the important systems that you review. Of course, also there is the CNS. So for the CNS, remember cranial nerve number one is part, cranial nerve, the optic nerve, the cranial nerve number two is part of the central nervous system. Okay, so here what you want to ask about number one, is the patient having any seizures? Are there any seizures? Besides the seizures, are they having any difficulties in vision? Okay, or even hearing problems? Is there any hearing problem? Because this is also CNS. Actually, remember the CNS and the ectoderm, which where the skin belong, all come from the, I mean, the CNS and the skin come from ectoderm. Ectoderm, you have got the neuroectoderm and you have got surface ectoderm. So some skin disorders, if someone has got some condition that is affecting the skin, it can actually mean also a CNS problem. Okay, for example, there are things that are coming out of the skin. It might mean there's actually a CNS problem also because they actually originate from the same place. So ask about seizures, visual problems, hearing problems, fainting. Is the patient fainting? Okay. These are some of the things that you'll be asking in the CNS. So this is the review of systems. Once you've reviewed your systems, now the fifth thing that you are going to do is you are going to go to the past. You are going to go to the medical history, past medical, okay, medical history. It's actually medical and surgical history. Medical and surgical history. So I'll be asking about what other conditions, so other conditions that are not part of the HPI, you can bring them here. Okay. So the number of previous admissions, how many times the patient has been admitted. So other conditions, it is actually here that you are going to ask about diabetes. Does the patient have diabetes? How about epilepsy? How about asthma? How about TB? How about HIV? Okay. These are the important ones, the dates, and also a sickle cell, very important ones. And then previous admissions, you ask how many times have the patient been admitted and for what conditions were they admitted, previous admissions. And then you ask, because it's medical and surgical, ask about previous surgeries. Has a patient ever had an operation? Most of them, if you say surgery, they will not know. But if you say, if you had an operation before, they will be able to know that. And then after that, you are going to talk about the drugs. So the drug history. With the drugs, you want to mention the current drugs and then also the past drugs. Okay, the current and the past drugs. Besides that, you also need to make sure you understand, is the patient allergic to any drug? So any drug allergies, any allergies to drugs. Besides the allergies, are they taking any herbal medications, herbal drugs? So these are the things that you are going to ask when you are finding out about the medical history. Now, depending on some doctors will not require that to ask everything. For example, if you go into the urology, okay, that should be, is it unit 5, urology. Dr. Mputu will tell you, you are clicking someone that has got kidney failure. You start asking about how many toilet, how many times, how many rooms do you have in your house. So there is some data that you expect that you ask, which is important to their system, not asking everything, because the next thing that you are going to ask now is going to be the family history, okay, and then the social economic. All right. So in the family history, what do you ask about? Basically, is there anyone in the family that has got the condition that the patient has? Anyone in the family that has got the condition that the patient has? And anyone in the family who has got chronic conditions? Okay. So those two things. Anyone in the family with chronic conditions, for example, anyone in the family that has got diabetes, asthma, epilepsy, TB, sickle cell, and such, because it really affects the patient. And then you have got now the socioeconomic history. This is important because it allows, you want to find out if in case the patient has to get some drugs, is this patient going to be able to manage to get those drugs? Okay, this is why you ask about the amount, what job does the patient do? Okay, is the job of the patient, is the patient married? Okay. For the job, you also approximate like the monthly income, because this will already determine if they can be able to do some things or not, some medications, are they able to get them or not. Monthly income, are they married? Okay. And then also the house where they stay. The house. How many rooms are there? Is it a ventilated house? Actually, about the marriage, this guy, some will put it in the family history, but family history mostly you look at the conditions that affect the family that could have affected you, and then marriage you put it in socio-economic because that is social. Okay. So ventilation, especially for respiratory conditions. Let's say we're clicking someone that has got anemia. Here you also need to ask about if they stayed in Kabwe, specifically because of lead in Kabwe. Lead, remember, causes iron deficiency anemia, and that thing is actually common in Kabwe. Okay. After you ask about the socioeconomic, you are done with taking of the history. The last thing that you do now, right, is the summary. And most of the doctors, they'll just require that you present your summary. So your summary should be very good. It should cover all the important positives and the important negatives in the history that you've taken. So how do you write a summary? So you start presenting. So you say presenting, let's say EM, you just use the initials of the patient. EM, let's say it's a male, 27 years. Another thing that I forgot in the medical history, or I actually mentioned the HIV status, very important. If you find out about the HIV status, please find out more. Find out about the viral load. Find out about the CD4 count. Are they on antiretroviral therapy? Are they compliant? Those four questions are very, very important. Okay, please find out about that. So you say presenting male 27, let's say maybe the HIV positive. So you see RVDR. Okay, don't write HIV positive. Just say RVDR, because even when you'll be presenting the cases in front of the patient, they will not know that you're talking about them having HIV. So just say presenting male 27 RVDR. Are they compliant? Maybe not compliant. So you say RVDR non-compliant. Okay, and then you start who presented with. Now you talk about the chief complaints. Let's say who presented with 2 week history of difficulties in breathing, 1 week history of abdominal swelling. But now here you can use medical terms. So who presented with 2 week history of dyspnea, 1 week history of ascites, maybe 2 day history of peripheral edema. However, there are no, you start mentioning what other features, because you are thinking of heart failure. What other features did the patient not have that you are supposed to have in heart failure? However, there was no, you start mentioning, okay, the other features that you're expecting to find in a heart failure patient that are not there. Once you are done with however there are no, those are the negatives, the important negatives. Then you give your diagnosis. For the diagnosis, you start with what we call the impression. We call this as the differential diagnosis. So for the diagnosis, you give three parts. You are going to give the condition, okay? So you are going to give the pathology, and then you give also the cause, and then you give the functional status. These three things should come out in your diagnosis. For example, you say the diagnosis is going to be heart failure. Okay, what is the cause? Maybe secondary to hypertension or hypertensive disorder. And then maybe this patient can't even wake. Uh, they can't do anything because of this heart failure. So you stage it. For heart failure, you can stage that to be the functional status. Okay, maybe New York, let's say stage 4 or maybe stage 3, and like that. So you've given a full diagnosis, and then you can give now the differential diagnosis. What other things can cause your presentation? Okay, this can be nephrotic syndrome, it can be chronic liver disease. Okay, it can be other conditions that can, it can be maybe the patient just has a hypoalbuminemia. They have got low albumin, so fluid is seeping out of the blood vessels. so causing the edema. So this is how you take a history, write your summary, present your impression. After you do this, now you are going to do the physical exam.